for suturing, if we do a regular suture here on our foam, on our skin here, if we go through, and then without the Hemiguard, if I pull on this, see how it's ripping the skin? It's going to rip through the skin on our patient. Then if I instead use our Hemiguard, place it about 1 centimeter away from our incision line, place the plastic down, and then this cloth part I put down without any tension, without any wrinkles. I once again can grab my suture. I'm gonna suture through the holes. These holes were created so that way you can do a vertical mattress. I do not like doing a vertical mattress on these because you can put too much pressure on it. However, if I pull through once again, you can see that my suture is not pulling through the skin. The Hemiguard is staying intact, and you can actually see back here, I'm recruiting that skin back there as well. So we have our incision here. We already put our Hemiguards down about 1 centimeter away from our incision, laying them nice and flat without any tension on them. Then I did a trauma stitch here, a near, far, far, near. And then you can see as I pull the suture, the skin's gonna come together there. So this is one way to do it. I've done this for larger defects that you need a little bit more pull. However, I frequently find that you don't need to do a vertical mattress or a trauma stitch. Instead, what you can do is you can actually cut off the hole. Like I said before, that's my preferred way of doing it. We can space this anywhere from about 1 centimeter to 2 or 3 centimeters away. Still about 1 centimeter from our incision line. Pull that backing off, lay it down nice and flat. You do want this nice and dry when you place it, so make sure you dry off your incision site. Really decrease the amount of blood as much as possible. You can reinforce these with steri strips if you would like, but I can place my Hemiguard there. It is okay if the Hemiguards overlap. You can even overlap the holes if you would like, especially on toes to help get that pull from multiple directions. But then I can take my suture here, go through, once again taking full thickness bites. You don't necessarily have to close the subcutaneous layer before you use these. It really is surgeon's preference, but we can go through. So once again, imagine that large gaping hole, and we can pull, and really we're pulling and recruiting that skin and getting it able to close. Between these Hemiguards, if I need to, I can throw regular stitches, horizontal, vertical, just simples, or do a running stitch over them if you would like. Once again, surgeon preference, but it helps recruit the skin around it. I use these on transmetatarsal amputations, ankle fractures, pylons, total ankles. I've used these inside a frame to help decrease the tension on the skin and get large flat foot incisions to heal, ischemic toes, yeah, really anywhere patients have skin.